3 odd signs you might have colon cancer. This lesson is about 3 strange things that can be signs of colon cancer. Before we talk about the 3 strange signs of colon cancer, let's talk about what it is. Colon cancer is also called colorectal carcinoma or colorectal cancer. It is a cancer of the large intestine and/or rectum. It can affect the ascending colon, transverse colon, descending colon, or rectum. Colon cancer is a very common type of cancer. It is the 3rd or 4th most common type of cancer. If you have a family history of colon cancer or an inflammatory bowel disease like Crohn's or ulcerative colitis, your risk of getting colon cancer goes up. Ulcerative colitis raises the risk of colon cancer more than Crohn's, but both of them do. Colon cancer can cause a number of different signs and symptoms. One of them will be stomach pain. In fact, this is the most common sign of colon cancer. We can also see changes in the size and shape of the stool. For example, if there is a large tumor, the stool can become very thin and pencil-shaped. There can also be changes in bowel habits such as diarrhea, constipation, or a mix of the two. However, this lesson is about 3 strange signs of colon cancer that can be found on the skin. Number 1. Leser-Trélat sign. This is where there's a sudden onset of many seborrheic keratosis lesions. Severe keratosis is a very common condition that increases in prevalence as the patient gets older. They are hyperpigmented, well-demarcated, round or oval-shaped lesions. These lesions are also raised skin lesions, and they can be found on the back, the chest, the arms, and the face and neck. But they can occur in practically any part of the body except for the palms of the hands and the soles of the feet. They're asymptomatic most often, so again, this is a very common condition that's found in general population as patients get older. But the key difference in Leser-Trélat sign is that there is a sudden onset of these lesions. So oftentimes in normal patients, they have very small lesions, and over the years, these lesions can slowly grow, become bigger, and darker in appearance. But with Leser-Trélat sign, there is a sudden onset of many seborrheic keratosis lesions. So all of a sudden, patient will find that they have many of these skin lesions. Another very important point to note about these skin lesions is that they are often pruritic, meaning that they are often itchy. This is going to be in contrast to regular seborrheic keratosis where they are not itchy. This Leser-Trélat sign is that there's a rapid increase in size and number of lesions, so there can be a sudden onset of many lesions and then they can rapidly increase in size and number. If a patient already has some of these seborrheic keratosis lesions that are from normal aging, and they all of a sudden have a rapid increase in size and number of lesions, this is also Leser-Trélat sign, and Leser-Trélat sign is considered to be a rare finding of internal gastrointestinal malignancies, including colon cancer. But it can occur in other gastrointestinal malignancies, like gastric cancer. It may be considered as a rare finding because it is underreported or undetected in a lot of cases. Because seborrheic keratosis is a very common condition as patient gets older. Leser-Trélat sign may go undetected in other cases, so it is important to think about when we see a lot of these skin lesions, especially if there's a sudden onset of a rapid increase in size and number of lesions, and if they are pruritic as well. Number 2. The second skin finding that could occur if a patient has colon cancer is what is known as malignant acanthosis nigricans. This is what acanthosis nigricans can look like. So acanthosis nigricans is a thickened hyperpigmented skin lesions. It's going to often have a velvety appearance. So this is how it is described. It is often found in intertriginous areas. These are where skin rubs on skin, so we can see it in the axilla and in the groin as well. Acanthosis nigricans is actually a common finding associated with obesity and type 2 diabetes. This is associated with insulin resistance in a lot of cases, but in some cases it may develop in patients with colorectal cancer, especially a colorectal adenocarcinoma type of cancer. Again, acanthosis nigricans is going to be a relatively common skin finding in the general population. So majority of cases are going to be due to insulin resistance, obesity, and type 2 diabetes. And then a small subset are going to be related to an underlying colorectal adenocarcinoma. In some cases, patients may have both a malignant acanthosis nigricans and a Leser-Trélat sign as well, so they may have both types of skin lesions. 3. The third type of dermatology finding that could occur in patients with colorectal cancer is what is known as hypertrichosis lanugosa acquisita or acquired hypertrichosis lanuginosa. This is when a person starts to grow fetal or lanugo hair. It is considered malignant if the lanugo hair has an underlying malignancy. Fetal hair or lanugo hair is fine hair that doesn't have pigment. It can grow long, but it's easy to pull out. In acquired hypertrichosis lanuginosa, this hair can grow in places like the eyebrows and pubic area. Acquired hypertrichosis lanuginosa affects the forehead, ears, nose, trunk, and limbs, but not the palms, soles, or perineum. It almost always results from endocrine and metabolic issues. But in extremely rare circumstances, an underlying cancer like colorectal cancer may be to blame. The hair growth can happen up to 2.5 years before the tumor is found. This is a very rare finding that can happen with an underlying colorectal tumor. It can also happen with lung cancer and breast cancer. So again, this is a very rare finding. The other two are more likely to happen, but they are also rare findings of rare presentation of an underlying colorectal cancer. So that's all for today. If you liked the video, make sure to give a thumbs up and make sure to subscribe. Thanks for watching.